Our speaker today is Kate Nederostek. Kate is a gerontologist and a certified dementia practitioner with 20 years plus experience within long-term care, dementia care, and family caregiver support industries. At the State of Utah's Division of Aging and Adult Services, Kate serves as the program manager for the Caregiver Support Program, overseeing the support offered to family caregivers by the area agencies on aging throughout the state. She also serves as the program manager for the Alzheimer's disease and related dementias program, which seeks to improve support for those affected by dementia and enhance dementia services throughout Utah. She's well respected in the field of aging services and sought out for her dementia expertise. Kate received a bachelor's degree in psychology from the College of Worcester and a Master of Gerontological Studies degree from Miami University, both in Ohio. At this point, we'll let Kate take over and present to us on the importance of early diagnosis in dementia care.
Excellent. Thank you so much. Appreciate it. It's a pleasure to be here. Thank you so much, Beth. I'm excited to be talking about this important topic with everyone. On this slide, you'll see everything that we are going to cover in our time together. So we're going to go over how many people are living with dementia, how often people are being diagnosed, the overall view of detecting and diagnosing dementia early, the benefits and the barriers to early diagnosis, what that diagnostic process looks like, and then we will cover resources available for healthcare providers as well as for families. So let's get started. So there's over 7 million Americans living with Alzheimer's disease. Currently, 1 in 9 older adults are living with Alzheimer's, and about 200,000 individuals between the ages of 30 and 64 are living with a younger onset dementia. I'm not sure if folks are aware, but Utah is actually the youngest state in the nation based on a median age of about 31. But we have one of the highest life expectancies, and about 12% of our population is over the age of 65. Knowing that increasing age is the greatest risk factor of dementia, Utah is just as affected by dementia as other states. In fact, about 10% of our older adults are living with Alzheimer's disease. Alzheimer's is the leading cause of disability and of poor health in older adults. It is also one of the leading causes of death. Here in Utah, Alzheimer's disease is the 4th leading cause of death compared to the 7th in the United States. Now, I'm going to pause for a second because so far you've heard me mention Alzheimer's disease specifically, not dementia, and that's because most of the data we have is specific to Alzheimer's disease. We simply don't have data for all the dementias, but it is safe to assume the numbers that I'm mentioning are greater than those when you factor in all the dementias. It's going to be much greater than those that I'm just mentioning for Alzheimer's disease. Though most people are aware of and are, I wouldn't say most people, let's start again. Though more people are aware of and are living with Alzheimer's disease and other dementias now than ever before, diagnostic rates are still fairly low. Approximately 50% of Americans living with dementia have never been diagnosed. And of those older adults living with mild cognitive impairment, or MCI, less than 10% receive a diagnosis. Additionally, only about 50% of those either diagnosed with dementia or their caregivers have actually been told of their diagnosis. So this means they have a dementia diagnosis in their medical record, but have never been told about it by their healthcare provider. Now, this is very reminiscent of the 1950s and early 1960s, when the issue of whether or not to tell cancer patients about their diagnosis was debated. Those in healthcare felt that sharing a cancer diagnosis could cause unnecessary anxiety or depression and lead to thoughts of suicide. Though there is little evidence of that, they felt that they were protecting patients from harm and preserving hope. Healthcare providers also argued at the time that cancer treatments were ineffective. So they felt there was really no benefit to telling a patient of their diagnosis because there was nothing that could be done about it. Thankfully, with extensive research, we know more and we treat cancer patients differently. The general consensus today is that patients have a right to know and understand their diagnosis. So let's talk about the general public's view on early detection and diagnosis. In a recent study of those 45 and older in the United States, almost 100% said that they feel it's important to diagnose Alzheimer's in the early stages of the disease. Almost 60% viewed cognitive screening for dementia to be a very important piece of preventative healthcare. And almost 80% said that they would want to know if they had Alzheimer's before either experiencing symptoms or before symptoms interfered with daily activities. So ultimately, people are in favor of assessing cognition routinely, of diagnosing dementia early, and of being aware of their diagnosis. But we still have low dementia diagnostic rates. So why is that? Well, before we get into that piece of it, let's talk about benefits of an early diagnosis before we get into the barriers for an early diagnosis and why the diagnosis isn't happening. So for those living with dementia, early diagnosis can mean a world of difference. So let's start with access to better treatment and early interventions. The earlier someone is diagnosed, the earlier they can start both drug and non-drug therapies that can manage symptoms and impact disease progression. How early someone is diagnosed can make a difference with the treatment options that are actually available. So for example, recent medications like lecanemab and donanemab are early, they're specifically for early Alzheimer's disease and are most effective when they're administered early in the disease process. We also see an improved quality of life as early interventions and strategies can empower patients to live more purposefully and independently for longer. Having earlier access to support systems, counseling, to brain health education can help folks focus on their strengths and live well with the condition. Early identification of issues can also help with implementing healthy lifestyle changes, such as controlling blood pressure, stopping smoking, participating in exercise, and staying mentally and socially active, all of which, of course, help with cognitive function. Though it's never easy, of course, to receive a diagnosis of dementia, receiving a clear diagnosis can bring relief by explaining the cause of years of confusing symptoms. In my work with folks living with dementia, I've heard numerous times the relief that is felt once there is finally an answer. Actually receiving a diagnosis demystifies the condition and will resolve the anxiety that person feels when they know that something is wrong, but they don't know why. So a diagnosis really helps folks to have a better understanding of their condition and what to expect, and they can start to move forward once they know what is going on. Early diagnosis not only allows for future planning, but also personalized care planning. A timely diagnosis allows that individual with dementia to be an active participant in planning their own care. This includes making important decisions about their legal, financial, and future care preferences while they're still able to do so, which enables the development of a personalized plan that's better suited to their specific needs and abilities. Knowing the progressive nature of dementia and the challenges that folks will have with decision making, problem solving, managing finances, and expressing themselves, it's important that families have as much time as possible to do extensive planning early. And finally, early diagnosis can provide access to clinical treatments or clinical trials, I should say, for new treatments. Again, with my work with folks living with dementia, I've heard numerous positive stories about being able to access new treatments for possible benefits, as well as being part of studies that may have benefits for others, even if folks felt like even if there was no benefit to themselves for participating in the trial, there was an impact by providing purpose and opportunity to help others and to be a part of something bigger than themselves. That was very important, and folks really enjoyed that process. Let's now get into the benefits of early diagnosis for those supporting the person with dementia. Now, I've always said caring for a person with dementia is unlike any other caregiving situation. The family members and friends involved need a lot of support, guidance, and education. Early diagnosis can help with reducing stress and improving preparedness for these caregivers and care partners. Knowing what to expect allows for learning about the disease and building coping strategies, which helps to reduce fear and anxiety. The earlier the diagnosis, the more time families have for planning for the future. Families can prepare for the emotional, the logistical, the financial challenges ahead. This includes discussion of future care, living options, financial planning, and legal arrangements. A lot needs to be taken into consideration, and being able to plan ahead really reduces potential burdens and then disagreements later on when you haven't talked to that individual involved. And early diagnosis opens the door to resources and support as well, like caregiver education programs, support groups, and other community services. These resources help families better understand the disease and its progression, which allows them to provide more effective and informed support. Caregivers can build the skills that they need, like communication strategies, behavior management techniques, how to provide personal care tasks, and learn about available resources like care consultations and support groups. For caregivers, connecting with support groups allows them to meet with others in similar situations and to reduce the burden that they feel. So it's important service to get them connected to. The more that caregivers and care partners learn, the easier they can proactively address any potential safety issues as well, such as driving or wandering. They can make necessary changes around the home for safety as the disease progresses. And as I mentioned before, it's important to also make financial plans and to mitigate issues like excessive spending and falling for scams and things like that that occurs because of decreased judgment or reasoning. Early diagnosis really allows families to seek out the necessary resources and supports in advance, which then will ease the emotional toll that is felt and the logistical burden of trying to manage everything. Early support can absolutely prevent caregiver burnout and ensure higher quality of care provided to that person with dementia. Most professionals that I talk to focus solely on the person needing support, not on the one or the many individuals standing behind that individual providing them with support. So I try to remember when one needs care, two need support. So I wanted to take a minute to go into exactly what support is needed along the caregiving journey. Caregivers and care partners take on many tasks, and you'll see over the next couple of slides what that includes. So they need a lot of education and guidance. For example, most assist with medical tasks when the person with dementia is no longer able to manage that themselves. So it's important to provide instruction on tasks like how to give insulin, checking blood sugar or blood pressure, dressing wounds, for example. Caregivers also need to know how to safely transfer someone or to properly assist in bathing so that they minimize any behavioral expressions that can occur due to the dementia process. Caregivers also aren't aware of all the supplies that are available to make their lives easier, like various incontinence supplies or raised toilet seats or grab bars or even motion detection cameras that can be installed to assist with wandering. It's vital for anyone supporting a person with dementia to become knowledgeable about the disease process so that they know what changes to expect, how to manage dementia-related behaviors, and to learn communication tips, redirection techniques, and ways to keep their loved one active and engaged. So that education is very important. There's also many community resources that people don't know about, but that can provide important supportive services. So connecting care partners to their area agencies on aging or any other state or local resources that can help with their specific needs is important. Emergencies are going to occur. That's just life. So it's important to prepare caregivers by supplying them with any dementia helpline numbers or helpful emergency numbers that they'll need to have. As far as keeping a loved one safe at home, that could involve navigating the issue of driving, how to avoid falls, or managing aggression or agitation that can occur with dementia and how to avoid that from happening. At some point, the question of how to arrange for care comes into play, whether that be selecting an in home agency or service or choosing a long term care facility. What happens though when there is an issue with that care provider? Caregivers struggle with how to manage that. They're unsure of their rights. They're unsure of what to expect as far as service. What should they be asking for? Or they're unsure of where to go if there's an issue, and if there's issue after issue after issue with no resolution, where do they go then? As I mentioned before, also planning for the future is vital given the progression of dementia and how it will affect one's ability to make decisions. So, caregivers need guidance on how to plan ahead, what services there are to help, and who they can talk to. They're also they also will experience levels of loss as dementia progresses, losing their partner or their parent gradually and long before their loved one actually passes away. So caregivers really need to be connected to resources to help them through this as well. Changes in relationships may also happen. So, for example, once we were husband and wife or mother daughter, but now we're caregiver and care receiver. Caregivers need help with navigating this and with maintaining that personal relationship so that it doesn't become transactional and only care focused. It's important to also consider what the caregiver needs to be successful. How are they managing stress? Do they have a support system? Do they feel confident in their abilities, or are they drowning? An area often overlooked is helping caregivers build their own informal network of support. Who can be included in these networks? Providing tips on setting boundaries and receiving assistance is absolutely needed. It's it's always difficult for caregivers to ask for help, and so being providing guidance on how to do that is very important. Helping caregivers connect with others on the same journey is vital as well. Friendships change because friends don't understand what's going on or why their friend, the caregiver, never calls or isn't available to get together anymore. When caregivers share a dementia diagnosis with friends, they tend to back away because they don't know how to respond or how to help. So, really, only those in the same boat understand and then become an important support network for caregivers. So, all the more reason to get those caregivers connected to each other. Caregivers also need respite, but don't know how to access it and feel guilty for even considering it as an option. Of course, support needs to be individualized to each caregiver, so that there may be even more needs than what I have listed in these last few slides. Um, and of course, we know different resources are available in different areas of the state. So if you're a healthcare provider or professional, do you have a social worker or a case manager who can manage all of this with your caregiver clients? If not, I would recommend referring to your local area agency on aging for all of this support for your caregiver clients. Again, with early detection, caregivers and care partners have the opportunity to access resources and support programs much earlier, which makes a difference in their ability to provide support to their loved one with dementia. Let's get back into benefits of early diagnosis. Not only do patients and their families benefit from early diagnosis of dementia, but healthcare providers and healthcare systems as well. First, we see improved patient outcomes, which is what we want in the long run, right? And the reason why so many providers go into the medical field to begin with. Being able to rule out other treatable causes of memory loss or behavior change and provide an early and specific diagnosis helps all providers understand the particular type of dementia involved, which then allows for more personalized and more effective treatment plans across all disciplines. Imagine, for example, physical therapists being able to better work with their clients when they understand dementia is involved. Providers will be able to implement more effective interventions for their patients when they're aware of the entire picture of what's going on with them. Early diagnosis can also reduce the financial costs of medical care and long-term care, not only for families, but also for the government when Medicare and Medicaid are the payer source. Early access to interventions that help family caregivers with managing behavioral expressions or interventions that alter the progression of the disease. This can all lead to fewer hospitalizations and prolonged independent living. Finally, let's talk about the benefits to overall society. So, early diagnosis allows more people to participate in clinical trials for new treatments. This helps accelerate research and potentially brings more effective therapies to market sooner. By speaking openly about their diagnosis, individuals can help reduce the stigma associated with dementia and then encourage others to seek help as well. And identifying risk factors and symptoms early through screening initiatives can help implement public health strategies that may help prevent or delay the onset of dementia altogether. So, we've talked about the benefits of early dementia diagnosis for all of these groups involved. So let's start talking about the barriers and again why we do have those low diagnostic rates. So, as a reminder, about half of those living with dementia actually have been diagnosed, and only about half of those individuals or their caregivers are aware of their diagnosis. And there's many reasons why. So let's get into these. First, I would say is stigma and fear. And stigma and fear associated with declining cognition and of course dementia. This stigma and fear keep individuals from going to the doctor to find out what is going on. Many will also deny that there is any issue altogether if a friend or a relative mentions that they've noticed changes, or they'll attribute those changes to something else. Now, denial is different from anosognosia that I have listed here. Denial is a conscious choice and actually a defense mechanism used to cope with potentially having dementia and not wanting it to be true. Whereas anosognosia is caused by damage to the brain that occurs with dementia. So it's ultimately a lack of awareness or insight into one's condition. So of course, this absolutely impacts whether someone seeks a diagnosis or not. There are also many myths out there that act as barriers still to this day to a diagnosis. I've listed a few here that I'll quickly go into. So first, the idea that dementia is a normal part of aging. It leads people to think that there's nothing wrong, and so they don't go talk to their doctor because this is a normal part of aging, right? It's what to expect. Many also believe, similar to cancer treatment in the 50s and 60s, that there's no way to treat dementia. So again, why would you go get a diagnosis? What's the point? Another myth is that there's no benefit to getting a diagnosis. And this is because folks don't understand what changes are involved with dementia or the importance of planning for future care, for planning for legal needs or financial needs. And then finally, the myth that dementia only occurs in older adults keeps individuals under 65 from pursuing a diagnosis. Many assume that they're dealing with something else instead. Other barriers to diagnosis for families include inadequate screening available in their area, or they're unaware of where to go for testing. Health disparities can also play a part in diagnosis rates. For example, individuals of color, specifically African Americans and Hispanics, are more likely to develop dementia, but are actually less likely to go to the doctor. And this could be related to higher distrust of the healthcare system within these groups. Finally, I'll go into more detail about this in a slide coming up, but concerns about costs as well as the lengthy process for getting a diagnosis can absolutely become barriers. So those are valid as well, but I'll talk about those in a second. So let's talk about barriers that providers experience. Talked about families and individuals potentially with dementia. Now let's talk about providers. So providers may hesitate to diagnose dementia due to a fear of causing distress or negative reactions with their patients. We talked about this already, but this is exactly why cancer was not disclosed years ago. So we still have those concerns today. Now, I went into detail on the previous slide how myths impact diagnosis, and those same myths can be a factor here with providers, so I'm not going to go into those again. Another barrier you see listed here is lack of adequate training. So this could be on lack of training on how to communicate a diagnosis that can actually make providers hesitant to deliver a diagnosis. This is a very sensitive topic, and being able to navigate it takes a lot of finesse. Dementia is common, but dementia expertise is not. So it's important for providers to continue to seek out education on how to have these conversations. Lack of training also comes into play when providers aren't aware or aren't sure of which diagnostic tools to utilize. That also becomes an issue. Providers are also not always aware of the resources that they can connect patients and their families to for help and support, or of the treatment options that can be discussed. There's also many system level barriers, such as limited time during appointments and insufficient information can make it difficult for a provider to arrive at a confident diagnosis. Providers often interrupt their patients on average every 17 seconds to get through their agenda for the visit. So are patients feeling cut off and that their concerns are not being addressed? But it's not that providers are horrible people who don't care. It's quite the opposite. We know that's not true. They just have so much to cover. Primary care providers, for example, have competing issues such as managing diabetes, heart disease, depression, preventive screenings, etc., all within a 15-minute appointment. It's simply difficult, if not impossible, to get to everything. So let's talk about the lengthy diagnostic process and the issue of there not being enough specialists as barriers to early diagnosis. For those who aren't healthcare providers, I think this discussion will be helpful, as you may not know what is involved. So the diagnostic process, what does that look like? There is no single test that can determine if a person has dementia. So typically many types of tests and many types of healthcare providers are involved. The process includes medical history and physical exam, which includes a review of past and current medical problems and concerns, medications, diet, use of alcohol, and medical conditions that are present in the family history. It includes a neurological exam that evaluates the person for problems that may signal other brain disorders and signs of a stroke, Parkinson's disease, brain tumors, or buildup of fluid in the brain. It involves cognitive, functional, and behavioral tests. These tests evaluate memory, thinking, and simple problem-solving abilities that may quickly assess changes in behavior and symptoms. Also included is mental health testing. So this includes depression screening to determine if dementia symptoms are coming from depression. Brain imaging is also involved. CT and MRI scans are used to see the structure of the brain. And this can show brain shrinkage and can rule out brain tumors, aneurysms, bleeding in the brain, nerve injury, stroke. Also, scans like PET scans or SPECT scans are used to evaluate brain function. Cerebral spinal fluid analysis is sometimes involved, and this is an analysis of the proteins in the cerebral spinal fluid. So how this works is a sample is collected via a spinal tap And there is an inverse relationship here. So the more plaques in cerebral spinal fluid means the less there are in the brain. And the less plaques in the cerebral spinal fluid means the more there are in the brain. And then also blood work. Blood work is often done to check for a thyroid hormone or vitamin deficiency, to rule out anemia or infections, and to check how organs are functioning. It's very exciting because in May of this year, the FDA approved the first blood test for early detection of Alzheimer's disease. So this is an exciting time to be a part of this. The new blood test really could be utilized with other detection methods and become the standard of care going forward, but it first has to be covered by insurance companies. So there's a process to all of this. And then finally, to kind of wrap up the diagnostic process, depending on the type of dementia, additional tests like speech language pathology assessments or genetic testing may also be needed to specify the diagnosis, to be able to determine which type of dementia you're dealing with. Again, this is all a lengthy process. Many patients don't want to go through all of this. It's a lot of driving to and from appointments, especially if there are no specialists in their immediate area. It's hard to get all of this time off work. The cost of each of these appointments, plus the test associated. These are challenges that folks are considering and really concerned about. Now, let's get into the types of providers involved. So the business end of dementia care is in primary care. Primary care providers often initiate and oversee the diagnostic process. In fact, cognitive evaluations should occur every year during the annual wellness visit or an annual checkup if that individual doesn't have Medicare. Sometimes primary care providers will make a referral to one or more of these specialists listed here. Some people with unclear symptoms, including those under 65, may require evaluation by two or more specialists who combine their findings to reach a diagnosis. So again, it's a lengthy process where you're potentially seeing multiple providers. Now, I mentioned previously, one of the barriers to diagnosis is the lack of specialists. In fact, in Utah, there are only 38 board certified geriatricians at last count. Why do we have such low numbers? Well, this is due to several factors. First, being the lower reimbursement rates that these providers receive from Medicare. Second would be a declining number of new physicians entering the specialty. In fact, geriatrics is still a relatively new board certified specialty that was established in the late 80s. And medical schools are not required to teach it. So not all medical students are exposed to geriatrics. And then finally, we're experiencing a growing elderly population with complex health needs. So all of this accounts for the fewer geriatric specialists that we have and can absolutely impact diagnostic rates. So you might be asking, okay, that was a lot of barriers. That felt very overwhelming. So what can be done about this? Don't worry, we've got some tools to talk about. All of the issues that I just reviewed, all of those barriers, really heightens the importance of dementia trained and dementia capable medical professionals. So I have some tools that I want to talk about over the next couple slides that will help with making an immediate impact and in kind of turning this ship around. So this first slide contains some resources to assist healthcare providers in managing dementia. Now, you'll all get access to these slides, so you'll be able to access these resources. You'll be able to click on each of the links and then be connected with the diagnostic tools that I mentioned, the CME opportunities, and the information on billing codes so that you can make the most of your time with patients. I would really love the ability to kind of open everything and show everything to you, but that's not really going to work here. So I'll try to show some of the ones that are the easiest to show. So let me stop sharing and get into this first one. Okay, so this first one is from the Bold Public Health Center of Excellence on Early Detection of Dementia and from the Centers for Disease Control and Prevention. This is a link, well, the link you'll get on the slide, but this is the toolkit. This is what it looks like when you click on that link and it can open it up. And this toolkit will really help health systems with improving their early detection of dementia. So just to show you this table of contents, you can see here what's involved in this toolkit. So what is dementia? Early detection, pre-screening, cognitive screening overview, and post-screening. So it's a good toolkit that can really, really help. The second link that is on the slide is also from these two organizations, the Bold Public Health Center of Excellence on Early Detection of Dementia and the CDC. And it's a link to a decision tree that will help with implementation. So it's another great tool. Second, this is a tool from the Gerontological Society of America, and they created a toolkit for primary care teams on supporting brain health and improving cognitive impairment detection. So this is a great tool as well. And just to kind of show you, so it mentions the KAER toolkit. So what does KAER stand for? It stands for Kickstart, Assess, Evaluate, and Refer. So you can see here what exactly is covered in early detection of dementia. So another great toolkit. Let me go back to slides so you can see the rest of what I'm going to talk about. Okay. So next, the next resource listed here is AlzPro from the Alzheimer's Association. This is a hub for clinicians, researchers, and other professionals in the dementia care space. You can find clinical guidelines and care recommendations through this site. Next, you'll see links to a website from Minnesota where you can find tools to assist with managing dementia within your practice. Next, there are several links there for free CME opportunities. So those are great to look at. And then we have the Huntsman Mental Health Institute's call-up program, which, if you're not familiar, is a statewide psychiatric consult service. So this is really great for providers. If you're not sure if we're dealing with mental health or dementia, you can utilize the expertise here through Huntsman Mental Health to help you. The next link takes you to the Centers for Medicare and Medicaid Services site that outlines the GUIDE program. And the GUIDE program is a pilot program of supportive services that CMS is testing out over the next 7 years. So there's information about the GUIDE program there. And we're going to talk about the GUIDE program in Utah in an upcoming webinar. So you'll want to come back for that so you can learn as much about GUIDE and how it's rolling out here in Utah. And then finally, the last link is to a PDF document that we created at the Utah Department of Health and Human Services to assist with managing dementia within your practice. The next slide, there we go. So things here that I'm sharing will assist healthcare providers in the care that they provide to patients and families, but will also help other professionals who are on the call in connecting folks to supportive resources. The first few bullet points are services provided by the Utah Department of Health and Human Services. The first link, which I want to show, so let me stop sharing and go back over here. Okay, so this first link that was listed there on the slide is a link to a PDF document that provides some dementia tips, some quick tips that families can look at and ingest really quickly. And it outlines helpful services available to family caregivers. So that's what that looks like. The next link on the slide is to our dementia.utah.gov website, which has helpful resources for people living with dementia, with caregivers, and also for professionals. The next few links, and I'm going to show one of them here, is the next few links are for flyers to free dementia care consultations that are provided through the University of Utah and Utah State University. Here you can see the one for Utah State University, where you can see Dr. Fouth and her amazing team meeting with a client. So again, provided through Utah State University, University of Utah, great resources. The funding for these services is provided by the Utah Department of Health and Human Services. And these care consultations are impactful meetings that help individuals with dementia and their families better understand dementia, connect to local resources, and put plans in place to navigate the disease process. I'm going to stop sharing and go back to this slide so you can continue to follow along. And we'll talk about a couple more. So the next resource then that is listed here are the area agencies on aging. So area agencies on aging are the boots on the ground organizations around the state providing dementia education and support, as well as other vital services. So connecting your patients, your clients, to their area agencies on aging is an important step to take. I do want to share one more resource. So a couple more actually. So let me go back to my resources and show you. Here we go. Okay. So the next, oh, I can't click on it. Let me try that again. There we go. Here we go. Okay. So this is from the Dementia Action Alliance. And so on the slide, the next link will take you to Dementia Action Alliance's website. They have a vast resource library. It's very impressive. And what you'll also find on that site is this manual that guides individuals with dementia in navigating their diagnosis. This is a very impressive guide. Let me just show you bear with me, there we go, the table of contents. So you can see what's covered in this guide. So, and that it's a whole approach to preparing for dementia and living well with dementia. So you can see here, living well with dementia is the topic. It goes through self-care and stigma and things like that. Well-being, staying connected to others, continue to exercise and live as healthy of a life as possible. Then we get into emotional, psychological, and functional health, life affairs, medical affairs, so technology supports, care partnering, so lots of excellent topics that, and again, if you're a provider and you have limited time to have conversations like this with your patient, you do have limited time, right? We've already discussed that. So this is an excellent tool to be able to connect and put in the hands of your patients. Another excellent tool is, there we go. So this is another guidebook for people living with dementia, and it's from Nevada's Dementia and Engagement Education and Research Program, or the DEAR program. So another great tool to put in the hands of your patients living with dementia. And I lost my mouse. There we go. Okay, I want to show you again. Let me get to it. There we go. The table of contents. So again, you can see kind of what is involved here: an overview of dementia, planning your health care, planning your lifestyle, pathways to well living, connecting with others, focusing on possibilities. So excellent, another excellent resource. Next, on that slide is a link to Lorenzo's House, which is a nonprofit organization that supports youth and their families dealing with younger onset dementia. Then on that slide is a link to the Alzheimer's Association. They have an extensive and helpful website. And then there's also the phone number for their helpline on that slide, which is available to offer support 24 hours a day, 7 days a week. I want to show my last few resources when I'm talking about AARP. So also on the slide is a link to AARP's website, which is another great resource. They have lots of helpful tools for family caregivers, a few being the two that I want to highlight here. So first, this is AARP's Family Caregiving Guide. And this is a guide in English, but they have one in Spanish and Chinese. There's a military version. So lots of versions of this guide, but look again at the table of contents. You can see what's covered with this guide. And again, this is a guide that will help family caregivers through their caregiving journey. What are the steps that I need to prepare for and need to take? So excellent resource there. And then another guide that's a favorite of mine from AARP is their Utah specific caregiver resource guide. Now, when you get this guide from AARP, and of course, all of these resources that I'm mentioning are free, of course. But when you get this guide from AARP, it doesn't quite look like this. It looks more like this, with some slight differences. So the coloring is different, is updated now, but this is the version that I have to show you today. But again, just wanted to show you the resources that are in here. So you can see links, or it talks about the area agencies on aging and how to get in touch with them, local resources throughout the state, and how those are supportive, as well as connecting you to national resources. So again, another great tool provided by AARP. And then back to our resource slide. So the last link here listed is to Utah State University's Alzheimer's and Dementia Research Center, specifically their research registry. We've talked before about how individuals living with dementia, when they get involved and are able to participate in research, how that makes them feel. They feel a lot better. They feel more purposeful. Family caregivers can get involved and get connected to research studies in Utah as well. So these are all wonderful resources that you can feel confident connecting patients and their families to. Okay, to wrap up, I want to, again, to underscore that early detection is a proactive step, and it leads to better outcomes for all involved. So if you're a healthcare provider, I encourage you to be aware of early signs and to have open and supportive conversations with your patients. And again, the tools that I'm sharing, you can actually go and watch videos of suggested ways to have those conversations. So lots of helpful tools to help you in your care. You can make a positive impact with how your patients and their families experience dementia. If you're a person with concerns within themselves or a family member, I encourage you to seek help sooner rather than later. Early diagnosis offers not just medical benefits, but a pathway to better quality of life. It empowers patients and families to make decisions, and it allows for families to build a strong support system for the journey ahead. This slide just has my contact information. Should you have any questions, should you want to reach out, you'll have access to this when to my contact information when the slides are shared. Again, I appreciate the opportunity to talk with you today, and I will pass the rest of the time over to Beth. Thank you so much.
That was wonderful. So I tried to keep up and share as many links as I could in the chat. I'm sure it was a lot of things happening at the same time. I did not share all of them. I just showed the ones that Kate directly sort of shared her screen. All of these will be available in the YouTube channel when this video is processed. We'll have direct links in the comment section for everyone. But we wanted to thank Kate for her time. Just wanted to let you know of a couple things coming up before you drop off. Kate, will you advance to the next slide?
Yep.
So as part of our funding mechanism, we collect data on these webinar series. Again, this helps us with deciding on topics, audiences, and also quality. So please take a minute to fill out the survey. And I'm going to be quiet for a moment while you complete this, but I would like you to stay on the computer if you can. And we want to show you some resources on the next slide as well. As you guys are finishing up that survey, we really appreciate that. We want to let you know that this is part of a larger webinar series. If you have not yet seen the flyer, I will put a link in the chat. This is to let you know about upcoming topics that we'll be covering. We have about 1 or 2 a month with different speakers. I also wanted to let you all know you can register for these through the ADRC website, which is listed here, ADRC. Oh, sorry, that's our email. I'm going to put our uh, website in the chat. This is part of a larger program where we are trying to recruit what we are calling dementia resource ambassadors throughout the state. So individuals that are interested in really having access to these resources that Kate just mentioned. So she's a wealth of knowledge. And we have the Alzheimer's Association here as well, also able to answer questions today, but part of this resource network. We have a lot of people in our state that have access to these kinds of resources that Kate shared with you today. And so if you're interested in staying up to date, being trained on what's available, you can, in a few months, start in our Dementia Resource Ambassador program. So there's information about that on our website as well.